Bile duct narrowing, how to understand strictures. Imagine a busy highway where traffic flows smoothly, but suddenly a section narrows, causing congestion and delays. That's similar to what happens when the bile ducts become narrowed or develop strictures. These strictures are abnormal narrowings that can block the flow of bile, a vital digestive fluid produced by the liver. The most common site affected is the common bile duct, which carries bile from the liver to the small intestine, helping break down fats and remove waste. When this flow is obstructed, it can lead to a range of health issues. The causes of bile duct strictures are varied. One of the most common reasons is injury during surgery, especially procedures involving the liver, gallbladder, or bile ducts. For example, gallbladder removal surgery, known as cholecystectomy, can sometimes accidentally damage the bile duct, leading to scarring and narrowing. Tumors in the bile duct, liver, or pancreas can also press on or invade the duct, causing it to narrow. Gallstones can get lodged in the duct, causing inflammation and scarring over time. Chronic inflammatory diseases such as primary sclerosing cholangitis, which involves long-term inflammation of the bile ducts, can also cause strictures. Trauma from blunt abdominal injuries or previous radiation therapy may result in scarring of the ducts. Infections, whether ongoing or recent, can contribute to inflammation and narrowing as well. Sometimes, doctors cannot find a clear cause, and the strictures are considered idiopathic. Symptoms of bile duct strictures often relate to the obstruction of bile flow. You might notice upper right abdominal pain or experience jaundice, which causes yellowing of the skin and eyes due to bile buildup. Itching, especially on the skin, can occur because of bile salts deposited in the skin. Fever and chills may suggest an infection developing in the blocked ducts. Nausea, vomiting, and pale or clay-colored stools are also common signs, as bile pigments are not reaching the intestines. Some people may feel generally unwell, lose their appetite, or even lose weight without trying. To diagnose a bile duct stricture, doctors relying on a combination of blood tests and imaging studies. Blood tests often show elevated liver enzymes like alkaline phosphatase and gamma-glutamyl transferase, along with increased bilirubin levels, indicating bile flow blockage. Imaging techniques are crucial. Magnetic resonance cholangiopancreatography, or MRCP, is a non-invasive scan that creates detailed images of the bile ducts. Endoscopic retrograde cholangiopancreatography, or ERCP, allows doctors to see inside the ducts directly and sometimes treat the stricture by dilating it or placing a stent. Percutaneous transhepatic cholangiography, or PTC, is another imaging method that can also be used to intervene. Endoscopic ultrasound can help evaluate surrounding structures and detect tumors causing the narrowing. Understanding how strictures affect liver health is important. When bile cannot flow properly, it causes cholestasis, which is a buildup of bile in the liver. This can lead to liver inflammation and damage over time. If strictures are caused by conditions like primary sclerosing cholangitis or tumors, they can increase the risk of developing bile duct cancer, known as cholangiocarcinoma, or even liver cancer. Early detection and treatment are vital to prevent serious complications like liver failure. Treatment options depend on what caused the stricture and how severe it is. Often, doctors perform procedures to open up the narrowed duct. This can include endoscopic or percutaneous dilation, where a balloon is used to stretch the duct, or placing a stent to keep it open. Surgery may be necessary if the stricture results from a tumor or complex scarring. Addressing underlying causes, such as infections or inflammation, is also essential. Regular follow-up is important to monitor for potential complications, including infections or the development of cancer. In summary, bile duct strictures are complex but manageable conditions that can significantly impact liver health. Recognizing the causes, symptoms, and diagnostic methods helps ensure timely treatment. If you experience symptoms like jaundice, abdominal pain, or unexplained weight loss, consulting a healthcare professional is crucial. They can evaluate your condition thoroughly and recommend the best course of action to protect your liver and overall health. Remember, each person's situation is unique, so personalized medical advice is always the best approach.